Yes, welcome Gorica Djokic to our CESI Insight series on the impact of Corona. Gorica, you have 20 years of experience as a neurologist at the Clinic for Mental Disorders in Belgrade, Serbia, and you represent, also, of course, today also the Serbian Trade Union of Doctors and Pharmacists, which represent and defend the interests of the staff, I would say, in the health sector more generally.
Yes.
How, as a trade union representative and yourself being a doctor, and as I understood, also reporting, unfortunately, 12 deaths of your colleagues, how do you experience the Corona crisis in Serbia at this very moment?
Unfortunately, dear Klaus, unfortunately not 12, it is 14. We had 14 deaths of our doctors. 2 of them were professors. It is, I don't know how to explain, but it is not normal that you lose 14 doctors in one crisis like this. And after that, we had some very, very bad informations when there was not a true number on media in Serbia, and official informations were wrong. Unfortunately, they told the public, government told the public that we lost 5 healthcare workers, and in that moment we had 12 doctors, and we do not have, unfortunately, numbers for nurses, because they trade union do not have that numbers, but we have very precise numbers. We have names and where the people are working and how good doctors they were. And unfortunately, it is because at the beginning we do not have self-protection. Unfortunately, government didn't tell that to the people and didn't tell that to us. Maybe better decision was to tell, okay, we didn't take this serious. We have pandemia report from 30 January, but we think it was nothing. So we made a mistake, sorry. Can you please help us to deal with the patients? I think 50% of us doctors will tell yes, even if their life is in danger. But they didn't tell us. We didn't have protection, so we lost our lives. It is very sad, and we are not feeling well. We had informations at every hour for the whole parts of Serbia, and we were very well organized, and from the beginning we are telling the truth. We are trying to get into media and to tell the truth. In this hospital there is no equipment. In this hospital they didn't do this. In this hospital they didn't do this. Unfortunately, only 2 free media, in Serbia were publishing those informations, but the government media, they were silent to this. When time passing by, more and more informations were released, and after 3 or 4 weeks after beginning of pandemia in Serbia, they told us approximately true informations. Then at some point they even tell trade union of doctors and pharmacists told us that and that. So we are trying to do our best. We had a lot of patients. We had a lot of health care professionals. Our numbers are about 600 healthcare professionals that are COVID positive. That is very, very large number. And if you know that there was 203 deaths in Serbia, and we have 14 doctors among them, that is a very large percent. And there was one unfortunate occasion when our president was on TV and told it is normal that a lot of doctors are dead because they're soldiers and we pay them to be dead. So I think that he didn't mean that. That was unfortunate circumstances because of the emergency state in the Serbia, but it was not a good information for us.
And I mean, basically, one of the big issues, like in other, of course, other countries too, was first the lack of protective equipment for the personnel, for the workforce in the public health sector, and second, of course, as you said, then also the lack of transparency. Had you known, would, as you said, also the doctors, or many doctors and nurses would probably even so have done it, but not knowing. So, of course, was also a particular tragedy. But what are now, since we were discussing earlier before this video a little bit how the situation is, it's a little bit, the curve is flattening a little bit, there's a little bit less pressure, is understood also in Serbia. And what are now the particular challenges for the medical staff?
There is, according to public information, there is less of infected patients. We do not have today's number because we will have updated at 3 p.m. But yesterday's number are near, it is 9,791 patients. It is less. It is approximately 150 to 200 patients per day, which are tested and confirmed as COVID positive. So pressure is a little bit less, and there is more protective equipment in the hospitals, and we are more organized, and healthcare is much better now than in the beginning. But we had some unfortunate circumstances that some managers, or we call it directors of the hospitals, were much oriented to the government and to what they told them to do than to their workers and co-workers. So we had situations that we have written or forbiddenness to wear protective equipment. So it was, I don't know how to explain that. It was very stupid and very bad. I don't know. Maybe they didn't understand the situation in a proper way. But there were individual decisions in some hospitals. Please don't wear equipment. That is not serious, and it is not good for the workers. So they lost any belief in their management in some places. So situation is like in all crises. It was not so good.
So you, as I understood, you also felt left alone a little bit by management in this situation. But how did you, as a trade union then of the Serbian doctors and pharmacists, react to the crisis? And what, in this very moment, and what are the priorities now in the short and long term?
Yes, at the first moment, our priorities were to save lives. and that was our first and only priority. And on the everyday basis, we informed crisis headquarters of the government and Ministry of Health of the government. Please, in this hospital you have this, in this hospital you have this problem. So we wanted to inform them to have the situation on the field. I need to tell you that was a moment, and this moment also, that we had best organization ever. We were tough, and we are tough and well organized, and we have information from minute to minute. So we knew everything on the field. There was a very interesting situation that a lot of doctors who are not our members and a lot of nurses who cannot be our members were giving us informations about situation on the field, because they told us you're the only trade union that is telling the truth, and you only care because we have on everyday basis we have information from the field, and we were releasing them to the public. So at this moment we are trying to get some kind of, not reward, but some kind of materialization of our effort. We pressed government to give us some kind of higher salary, and they told us that they will give us 10% of salary higher in this situation. And they told us that it will be permanent. But situation on the field is somebody get 10%, somebody not. It will be not permanent, somewhere it will be permanent, so situation is not homogeneous. So after that, when the crisis was on the top, we asked that all our doctors and all healthcare professionals had 100% of their salary during their illness or during the isolation, because they need to be isolated when they're sick. We also didn't get, they told us that it will be like that they will have 100% of the salary, and when the situation is when the situation is not on the top, we didn't have it at all. So then we had situation that two parents are working in the healthcare system, and they were working in the first line, and what to do with the kids. It was forbidden that the grandparents and people older than 65 years go out from the home. They were closed for 2 months almost, and nobody can help them. So we asked, please release one parent, or please release healthcare professionals who has very serious illness, because we are people too. We have illnesses. We are vulnerable. But it was not like that. They told us that if we have a temperature and very severe symptoms, we can go to isolation, but we were not tested routinely. Unfortunately not. They were waiting for us to have very, very severe symptoms.
And but also to break it down to the activities you made. These were then very successful activities.
Yes.
Understood, in the defense of your members, and in the defense also of the entire workforce, I would say, of the public health sector. And
Yes.
you also mentioned a strong solidarity at that moment. So it was also a moment where your trade unions proved to be really an important tool, where membership in your trade union was a clear asset.
Yes, our trade union was, I think, first and only trade union that was prominent in this situation. There was no media. When I searched for some information last night after my duty, I saw that almost every local media, which is not in government, under the government's care, had some information from trade union of Serbian doctors and pharmacists. So our word is here. And a lot of companies, private companies, donated to our trade union equipment for self-care, and we distributed all over the Serbia to healthcare professionals. So we did everything that we can do in that situation.
If maybe to come slowly to the end, I would nevertheless would like you to ask, because you're a doctor working also on mental health, in
Yes.
how far, I mean, this whole situation, if we look not only of the healthcare sector, but it's workers in general to be, or citizens to be confined. What do you expect? What is the pressure? What are people actually going through at this moment? I mean, we're slowly seeing the end of the tunnel, but
Yes.
What would you say? What is your professional? Because it's a unique situation in which hardly anyone has been, at least for many years and decades. Yeah, how do you assess this from your professional point of view?
We were organized institutions. There are not so many specific institutions for psychiatric or mental care in Serbia. We had a lot of mental care professionals in public hospitals, but specialized clinics and institutions, especially in Belgrade, and in Niš and in Novi Sad, in large cities, were organized to psychosocial consulting. And for example, my clinic has 24-hour open phone, free phones for psychosocial help, and their numbers are more than 4,000 calls from the people. Mostly people had panic attacks, generalized anxiety disorder. They need help for specific situations. Many our citizens were poor, do not have anything to eat, unfortunately. And another institution in Belgrade called the Institute for Mental Health has a special line for healthcare professionals, which is also very good idea. So Clinic for Mental Disorder Lazar Lazaric was helping public, and Institute for Mental Health was helping healthcare professionals. So I think it was organized very well. So, but I think we need to have those activities for approximately 6 months, or maybe a little less, but we will have like pandemic of mental health issues after this, because a lot of people are reacting at the moment, but a lot of people are reacting after that.
Gorica, I think, thank you very much. I think you're not only a hero as a trade unionist, but a hero, of course, as a doctor, as someone who's not only helping other doctors and nurses, but also helping, of course, those who are in need of healthcare. And you are, as we're clapping every evening at 8 o'clock, and this evening, I will definitely be clapping for you, the doctors in Serbia. Do you have a final message for us, for the CESI community?
Thank you so much for this interview, because you're sending information to all our colleagues in Europe that we did our best. All members of the we call it main, I don't know the term in English, it is not proper term in English, but our core of our trade union, we are all on the field. So we have everyday activities as a trade union and as a doctors. It is not easy, but we did our best. I need to tell you that we were in contact with our friends from Italy, with Daniev, you know. They had very severe situation, and we were communicated, and we tried to help them as we can. So we were in communication to give our best for them and to be with them and to think about them, because they have more severe situation. Also our friends from Spain. So we are dealing with it.
Yeah, I think a more concrete sign of solidarity is hard.
Yes.
Is hard to show.
Yes.
Is hard to find. Thank you very much. Take care of yourself. Take care of the colleagues. Take care of your colleagues at the Serbian Doctors and Pharmacists Association, and take care of Serbia.
Thank you, Klaus. Thank you. If we didn't do that, I don't know who will. Thank you so much.
Yeah.